Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for joining us for our regular COVID update. At the very high level, if you only have 10 seconds to know what's going on today, both of our efforts are making good progress. The first effort to reduce the COVID infection and spread in the county, very good progress. Our active cases are down now to just over 1,400. Positive test rate down, lowest it's been in many weeks, to 3.7%. And our vaccination rates are up. We're just shy of 47% of county residents vaccinated, making us one of the highest counties in the state. So we're doing good work. We have more work to do, and I really want us to continue to pick up the pace on both of those efforts. And thank you to everybody that is doing your part on all of those fronts. By the numbers right now, we are just over 14,000 cumulative COVID cases since the beginning of the pandemic, with just shy of 340,000 total tests completed, 12,422 recovered, and thankfully no additional fatalities to report since our last update, so we remain at a number that is still far too high, 247 Ulster County residents taken due to COVID. Hospitalization rates are also down from our last update. We're now down to 12 Ulster County residents currently hospitalized. Unfortunately, 4 of them are hospitalized in ICU beds on ventilators, but that is down fairly significantly actually from our last update, so that data point is encouraging as well. Active case count, as I said, this is also down, and you can start to see what is hopefully a continuing trend of downward slope in the active case count. We're now down to 1,407 active cases. The peak, of course, in our very long second wave was over 2,500. So we are making good headway coming down, but we do still clearly have work to do to bring down the active case count. The way we bring down the active case count is through the new positive test rate, making sure that we're slowing that spread each day of new people that are still contracting COVID. And again, good progress here. In the last 48 hours, we have tested 2,891 of our Ulster County residents, which is a pretty high test rate, one of our highest in a 48-hour period. So we're still doing a lot of testing. And of those tested, 107 residents were new positive COVID cases, putting us at a 3.70% new infection rate. It's still higher than we would like, but it is much improved from 5 to 6 to 7% that we were at just a few weeks ago. And it's even improved from where we were over the previous 96 hours. In my last update, we were still right around 5%. So if we can get that new positive rate down and keep it down, we'll finally get the active cases in check, and we'll see hospitalizations come down and fatalities come down. So again, we're making good headway there. And I do think we're starting to see the impacts finally of almost half of our population being vaccinated now, which without a doubt does contribute to the slowing spread of the virus. Hospital capacity, we're in good shape here. You can see the current numbers of 12 and 4 on the left, and then more than adequate capacity for the medium and long term. Despite all the good news and the progress, that is not an excuse or a reason to let down our guard. We absolutely still have to wear masks. We still have to maintain distance, wash hands, and avoid social gatherings. Until we get to herd immunity in terms of about 80% of our population vaccinated, which is going to take us at least several more weeks, if not months. Until we get to that point, we can't even really begin the discussion of letting down some of those precautions and restrictions. And I know that's what we all want to get to. So the faster that you and your loved ones and your friends and your neighbors get vaccinated, the faster we can begin to ease more of those restrictions and get back to normal in schools and businesses and work and everything else. Vaccine allocation for this week. This is an update from Tuesday. On Tuesday, we had just gotten our numbers for our county health department. We now have the county-wide allocation for all of our partners as well as the state site. So this week, Ulster County has been allocated a total of 10,480 vaccines. We continue to see this allocation go up, which is very good news. The breakdown of that 10,480, once again, 4,170 of them, 4,170, are going to our county health department to be distributed at our county pod sites and at some of our walk-in sites, which I'll talk about in a moment. The New York State-run site this week was allocated 3,510 doses to be distributed there. And then the remaining balance, which is 2,800 doses, were allocated across all of our different partners, pharmacies, hospitals, doctors' offices, and other providers. And so, again, the total is 10,480. We're just beginning to reach the inflection point in our allocation where for many, many weeks, the demand was much, much higher than the supply. We had people very upset and frustrated, rightly, that they weren't able to get vaccine as quickly as they wanted. We're now beginning to approach the point at which most folks who have been proactively seeking the vaccine have been able to get it. We regularly have appointments still available. Our pod sites at the Hudson Valley Mall and our walk-in sites have adequate supply. So for anybody that is wanting the vaccine, there is more than adequate supply now. And now we're getting to a point where we're going to have to use new techniques and get creative and really engage the whole community to get folks that have been more hesitant or have had barriers to access to the vaccine. We have to work together to get the remaining balance of our county, which is still tens of thousands of people, to get them vaccinated so that we can all reach that herd immunity point and all feel that sense of health and safety. So we're all going to have to work together on that front. I'll talk more about some of our new approaches there in a minute. Our current vaccination locations for this week, continuing to run our main county point of dispensing site at the Hudson Valley Mall and the former Best Buy location there. You can see our other partners, including the state-run site at the county fairgrounds, hospitals, both Ellenville and Health Alliance, as well as our pharmacy partners allocating this week. And as always, a special shout out to Dr. Neil Smoller and his team at Village Apothecary. They're carrying much more than their share of. They've done tens of thousands of doses just alone with that great team. So thank you, Neil, once again to you and your team for that work. I think the major announcement today in terms of our vaccination efforts is that because we're seeing now more supply as compared to demand, we are going to continue to implement new approaches to make it easier for people and more accessible for people to access this life-saving vaccine. One of the things we've wanted to do for a while is to open up walk-in vaccination clinics so that you don't need an appointment. And we want to open them at sites that are across the county so that folks in other parts of the county don't have to drive or deal with transportation issues to get here to the main site in Kingston. So beginning actually today, we had our very first, as we speak, walk-in clinic in Kingston. But next week, we're going to begin what will be a series of us going out to all the corners of the county and holding walk-in clinics, meaning no appointment required, just show up to be vaccinated. So I'm going to put up a preview of those different sites now, and I'll talk through each of these. As we speak at the Andy Murphy Center on Broadway in Kingston, we're holding our very first walk-in vaccination clinic in partnership with the City of Kingston. So I'd like to thank the mayor, Mayor Noble and his team, and all the workers and volunteers working at that site. That will continue to go until 4 p.m. So if you're out there and you're hearing this and you don't have an appointment, that's okay. You can walk right in to the Andy Murphy Center in Midtown Kingston, and they will take care of you. That's until 4 p.m. today, and that's been going well today, but we do still have vaccine available there. Starting next week on Monday, April 19th, we'll go down to Marlborough at the Justice Court and the Marlborough kind of town complex there on Milton Turnpike. We will have both pre-appointments to book if you'd like, or you can just walk in, and those hours are from 12 to 7 p.m. So we'll give people both options. If you would like to book ahead and guarantee a spot, you can do that. If you want to just show up, we anticipate there will not be extremely long wait. So you can show up anytime between 12 and 7 p.m. The next day, on Tuesday, April 20th, we'll go out to the Shandaken Town Hall and work with town supervisor there, just like we're doing in Marlborough. And I want to thank Supervisor Lanzetta in Marlborough, Legislator Corcoran, and all the team helping us coordinate that one, as well as the leadership in Shandaken and in the surrounding area, Supervisor Stanley and the team there for their work. Tuesday in Shandaken, that will be from 12 to 7 p.m. Same thing, you can pre-register and get an appointment, or you can walk in. And then finally next week on Saturday, and I apologize, the date is incorrect on that slide, so we'll get that fixed. Next Saturday, which would be, let's see the date. My apologies. I want to make sure we have the right date here. That will be Saturday, April 24th. Saturday, April 24th from 9 a.m. to 5 p.m. at Ellenville High School. That'll be another walk-in clinic in the southwest part of the county. So again, next week, for those that aren't able to or don't want to come up to our main site in the southeast, the western, and the southwest part of the county, will have all these walk-in clinics. And again, I want to thank all our partners making those sites run and helping us to spread the word. Please share this information out among your networks and your friends to make sure that everybody has awareness about this. And let's get the remaining portion of our residents vaccinated. We'll talk here now about the numbers on our vaccination progress. We now have 83,705 residents of the county that have received at least their first dose. We have just shy of 54,000 that have received the complete vaccine series, and that puts us at 46.9% of Ulster County residents with at least one vaccine dose. That is really impressive in now an 18-week time period where we started from zero. We've gotten tens of thousands of folks vaccinated, but we still have a lot more work to do. And so anyone out there who has other ideas about how to creatively set up vaccine sites or clinics, community leaders and others, we're happy to work with you. If you think there's a group of folks who are having trouble accessing vaccine, you can reach out to us, and we're happy to coordinate with you to try to figure out whether we can do a one-time site or to direct you to the nearest opportunity. But we're going to have to get creative to figure out how to get to the next set of people. And we're also going to have some work to do to make sure that we address concerns and reasons for hesitation, which we know are out there, and I understand. So we're going to do more work there and hear from some of our medical and health experts as well to answer any questions and address any of those questions. Anybody out there in the county that wants to learn more or just see this information directly, you can go to our Vaccinate Ulster page. That's vaccinateulster.com. There you can sign up for appointments. You can sign up for our pre-registration list and our information list, so then you'll get emails every time that we do have events coming that you can share out. So please go to vaccinateulster.com. For those with transit issues, I've talked about this before, but as a reminder, Ucat will continue to offer free rides on our Ucat buses throughout the county for anyone going to vaccine appointment. And for seniors and those with disabilities, if you call ahead, we're happy to come door to door, curb to curb, to bring you from your home to the vaccination site and back. And so thank you to our Ucat team doing that work. Finally, we still need volunteers, as always, and you will receive a stipend. So you can go to ulstercountyny.gov/volunteer. And thank you to all of our current volunteers, including those working today at our Midtown Clinic. Finally, as we wrap up and do our thank yous to all of our frontline workers and essential workers that have been getting us through the pandemic. I wanted to give a special shout out this week to a group of folks who many of you have probably spoken to, but maybe not met in person. That is the incredible team of telecommunications specialists who work in our Ulster County 911 center. This, across the country, this week is actually National Public Safety Telecommunicators Week. In short, that's the week to recognize folks across the country who operate our 911 emergency operations and response centers. Here in Ulster County, we have an incredible team. This is a group of people that work literally 24/7, have not taken any break for obvious reasons during COVID, during any of our storms. In fact, they've been busier than ever in each of these crises and emergencies. This year alone in Ulster County, our team of 911 operators and specialists have answered and responded to 83,000 911 calls for service that come into that call center over the course of the last year. They expertly deal with those, often literally on any given day. When our 911 folks pick up the call, you're probably talking to someone on what's quite possibly the worst day of their life. They're in a terrible situation. They need not only response, but someone to listen and care for them. And so thank you to our team of telecommunicators who do that work. And also when I was visiting with them today, I also got to chat with our new mental health expert, a licensed social worker who we've now embedded into our 911 call center so that folks calling with mental health crises can, right in the same room, speak to someone who's a trained expert in that and make sure that we're responding to mental health crises with the right response. And we're also training all of our 911 operators to be more adept at answering those calls. So thank you to our team that have been doing that work and will continue to do that work. It's one of the coolest parts of our team Ulster County here. So thanks to them. Thanks to all of our frontline workers that are doing similar work, putting themselves and their families at risk through this crisis and continuing to do so. Thank you to each of you for joining us today, and if you've been joining us, thanks for continuing. We've got more of these updates. I think we've done at least, I forget the exact count. I think we're approaching 100, or maybe we've done 100. But thanks to everybody that's watched some or all of those. Our next update will be on Tuesday at 3 p.m. In the meantime, anything that you need, please call our Recovery Service Center. That's 845-443-8888. And before I leave, I'd be remiss if I didn't thank the Radio Kingston team and our team, our interpreters and translators, Diane and Manuel, who've been with us for every single one of those updates. Thank you all for doing that piece and helping us communicate during this challenging time. We'll see you all in a few days. I hope everyone has a good weekend. Stay safe and healthy and resilient, and we will see you soon.